The Healthcare Security Cast is sponsored by 3D Network Technology. Reliability is our core value. Visit www.3dnetworktechnology.com. And by Genetec, delivering security strategies for healthcare. Visit Genetec, that's GENETEC.com. And by the Change Execution Group. Visit 360lifetransformations.com. Before we get into today's show, I want to invite you to connect with the Healthcare Security Cast on a new platform. It's a text-based platform called Community. To join, all you have to do is text my community number, and that number is 647-372-2042. That number again is 647-372-2042.
Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brian Hamilton.
Welcome to the Healthcare Security Cast for Tuesday, December the 1st. I have the pleasure of being joined today by Brian Uridge. Brian, thank you for joining us today.
Well, thank you for having me. I'm honored to be here.
Awesome. And I'm looking very forward to this interview. I've had a number of people say some really great things about you, including some past guests. So I'll start off by asking the kind of loaded question I like to begin with. Who is Brian Uridge?
Wow. Well, I guess depending on who you talk to, you might get a few different answers. I guess, I was one. Brian Uridge is someone who grew up. I spent my whole life wanting to be a police officer and a firefighter. And as I made my way through the educational system, I realized, wow, there was a place called Kalamazoo Public Safety where I could be both a police officer and a firefighter at the same time, all wrapped into one, along with being a medical first responder. And I was like what I like to say is your stereotypical police officer, meaning everything was based on enforcement and tickets and arrests. And that carried me through probably the first 15 years of my career, where I like to say I had that aha moment one day where I was in a community meeting on the east side of Kalamazoo, and there was a neighborhood worker who was talking about the crack cocaine problem that they were having. And I realized during the conversation that she realized that we weren't ever going to totally do away with the crack cocaine problem, but she wanted to be able to trust law enforcement and trust me that we were going to work together and be partners to work towards this issue. And that was really my aha moment where I realized that law enforcement, which then eventually transitioned into healthcare security, is less about enforcement and very much more focused on compassion and customer service and community outreach. But it took many years of thinking a different way till I finally realized that, and that has really helped me in my transition into healthcare security.
Excellent. And one thing I found interesting when I was preparing for this interview was you're also a licensed helicopter and airplane pilot. Is that correct?
I am. You know what? I forgot that. So along those lines, when I was a little kid, I would draw pictures of helicopters, and it was just an absolute passion of mine. And so many years later, I took one of those introductory flights, and I was hooked. And although it's absolutely way too much money to spend on any one hobby, I'm I'm a helicopter pilot and an airplane pilot. And then luckily, me and one of my buddies actually own an airplane together, which makes it a little more cost effective. So definitely a fun but yet very expensive hobby. One of the things I really like about it, it's challenging. It takes a lot of effort, but the people that you meet while you're involved in the hobby, the other people that own airplanes and fly it. It's really a good group of people. So it creates a whole other friend group where that's a rewarding part about the hobby as well.
Excellent. And I always echo kind of the same thing about the healthcare security community as well. It's a great group of individuals, and once you get in, you get to meet the people that are involved with it. It's kind of similar experience to what you're talking about. So I'll kind of shift back to that now. Can you tell us a little bit about your career path and how you ended up getting into the healthcare security field?
Yeah, absolutely. So, as I said earlier, I spent my whole life growing up wanting to be a police officer and a firefighter. And eventually when I was graduating from college, I learned of a place called Kalamazoo and Kalamazoo Public Safety, which incidentally is the largest fully integrated police, fire, and medical EMS department in the entire United States. So the best way to explain it to people is imagine driving around in your police car, and then all of a sudden you get called to a house on fire, and you drive there in your police car, and you go to the back of your car to the trunk, and you open up the trunk, and you strip down from your police clothes, and you put your fire gear on and go fight the fire. So it's a very efficient way to spend tax dollars, and it was a wonderful career. So I did that for 23 years. And I was very fortunate. I got to work on drug investigations and criminal investigations and training and firefighting and supervision, and just had some of the best mentors. And I learned so much about compassion and customer service and things like that as a police officer there. And so I actually was able to retire from there, which was really nice. I retired as their assistant chief of operations. And after that, I was very fortunate to get hired at Spectrum Health as their director of security. Spectrum Health is a large health system on the west side of Michigan, a great health system. And then after working there for almost 3 years, I then now am at U of M, and I've been a director of security for a little over 2 years at Michigan Medicine. And probably for the last 3 or 4 months, I've been a deputy director of public safety as well. And just what that means is that you are a deputy director for public safety for the university and any of our campuses, whether that's Flint or Dearborn or Ann Arbor. But my primary role is director of security for the actual health system.
Excellent. So I guess it's in a different way now, but I'm sure there's still a degree of your role that involves putting out fires.
It really does. And now that we've been in COVID for the last 8 or 9 months, it definitely does. And honestly, transitioning from law enforcement in an urban area into healthcare, although there were some things that were different, there are so many similarities that I'm sure we'll talk about later on in the interview. And that really is where, about in the first question about that aha moment and that compassion and customer service and that community policing based security, that model has really been what has worked really well in healthcare. In fact, I always say I loved working in law enforcement so much and never thought I would be lucky enough to find another passion. And I've been very fortunate to find something I love, which is being part of a wonderful healthcare community at U of M.
Awesome. Now, one thing that you had alluded to a little bit earlier was just mentorship. Now, I know I had mentioned specifically Brad Estep and Sean Boney, both were on the show and both mentioned your leadership and how it's impacted their career. Who are some of the individuals that stick out as mentors for you?
Wow. I have had so many great mentors, whether it's been in law enforcement, firefighting, or healthcare security. And the first thing, and when people ask me, oftentimes we make the mistake of realizing that, or we think that a mentor has to be someone of a higher rank than you, meaning one of your bosses or someone like that. And that could not be farther from the truth. I've had some of my best mentors have been administrative assistants. They've been frontline police officers, frontline firefighters who have just been fantastic people. So right off the bat, people who stand out to me as incredible mentors. Jeff Hadley is our former chief of Kalamazoo Public Safety, a wonderful individual. He left after 10 years, and now he is a chief down in Georgia. Hilary King, who is just been an incredible role model and mentor for me at U of M. She is one of our healthcare leaders, one of essentially like a chief operating officer for the health system. And she has just been a wonderful mentor. And then obviously Brad Estep, Sean Boney, I mean, just top-notch people from the healthcare community. Jim Bivins, who was with me at Spectrum as well, and now he runs security, a large healthcare system down in North Carolina. And then finally, just an absolute wonderful mentor has been Eddie Washington, who is our executive director for the University of Michigan Public Safety, and he is the former colonel of the state police in Michigan, and just an incredible visionary and exceptional leader and mentor. So I've been very fortunate.
Awesome. Now, in terms of mentorship, this is something that's been a topic that I've been spending a lot of time on lately. I'm just curious to get your thoughts. What does mentorship mean to you?
Mentorship means to me is a way to help create the future. When you leave an organization, you hope that you somehow leave it a little better than how you found that. And part of that is making sure that the people that you were able to have relationships with, you were able to lead, that led you, that you were able to mentor, learned something from you. And probably the biggest compliment that I think you can ever receive is when somebody says, wow, I learned so much from you, or thank you for your advice. And I think that's better than a paycheck. And it's so important. And I think, unfortunately, in today's day and age, it's oftentimes overlooked, especially now that we're so busy, now that we have healthcare issues, and on top of that, COVID. I think mentorship is kind of on hold, and it shouldn't be. This is one of the times when we really need mentors.
No, and I agree with you. And it seems like this would actually be an easier climate to mentor people, and you could have so much more reach. But yeah, it's interesting. I find that there's a little bit of hesitance from both sides. I think some people kind of feel like for them it's difficult to be a mentor. They don't think that they're worthy. And then, when you look at the mentees, a lot of them are just don't think that someone's going to want to give them the time of day.
Well, and that's where it all starts with the relationships. It all starts with, you've got to have real relationships with your staff and build that trust so that you can eventually have that mentorship and have that ability to communicate at that level and be the person that people can go to. So important I totally agree with you there.
Yeah, and I think that's a good transition there, because you talk about building relationships. Now, one thing that we've spoken about prior is culture. And strategically, I think it's an area that requires a leader's attention really early on. And you've had a couple of these transition points where you've been able to come in as the new guy and have an impact on the culture. At least that's my assumption. Why is culture such an important element in the programs that you've led?
Well, culture drives everything. It is the foundation of everything that we do, and it impacts everything that we touch. So, I always like to say, especially imagine coming into a place, the first thing you have to do is build real relationships. And you have to be vulnerable, and you have to be transparent. So once you start to build real relationships, those relationships build trust. And through that trust, it actually will build teamwork. And that teamwork, that helps create the mission. And then ultimately, that mission creates culture. The culture of, just to give you an example, at Michigan Medicine, we consistently focus on creating a culture where people not only are safe, but that they feel safe. And you'll hear me say that more than once. It's so important. And we saw it after 9/11, where so many people didn't want, they were scared to fly, yet we saw an increase in people driving, and we saw an increase in traffic accidents, but people were so scared. It's one thing to ensure people are safe, but to ensure that they feel safe. And you have to create that culture so that people understand that's where we're going. And that's so important.
Right. No, that's a really good point. Now, what are some of the changes that you've implemented to positively impact the culture at your organization as well as the other organizations you've worked at?
So when we talked about culture, one of the things that we really focus on at Michigan Medicine is understanding that each hospital is a community and every floor is a neighborhood. And that's where, if we think about that first question that you and I were talking about that community policing based security and building that trust and compassion. So if we use that philosophy of every hospital is a community and every floor is a neighborhood and every neighborhood is different, if we focus on that part of it, that's what we do at Michigan Medicine. And so what we ask our officers to do is to basically go out and do 2 contacts per day with someone that they've never met. So if you can imagine, like we said earlier, where you have to focus on not only keeping people safe, but making sure that they feel safe. So we actually have our staff go out and they have to meet a person that they've never met, a visitor or a patient every day, and meet an employee that they never met and engage them in a 2-minute conversation about nothing. And the focus is to build those relationships and to make sure that people feel safe. And it's been probably one of the most impactful things that we've done over the last 2 years, because it's helped change a culture where people are more trusting to engage security and talk to them when they have specific issues.
Right. Yeah. When you build that those relationships and that rapport early on, it really, I found this working as a frontline officer myself. People are more prone to come to you when they have issues. Sometimes it could be a negative, because the one thing I always go back to is I would get text messages on my days off from people working, assuming that I was there at the hospital. But it does really put a face on the organization. From a security standpoint, anyways, it puts a face on the department and really makes it a more human experience.
You're absolutely right. And one of the hardest things that we as a healthcare security culture need to focus on is making sure that we train and mentor our officers and our leaders to understand that it's ambassadors first and security second. So if we can focus on that relationship and get people to build their trust and act as an ambassador, it helps create a culture where people feel safer. And I'm very passionate about that piece of it. And that takes daily reinforcement and daily leadership to make sure that we are moving towards that direction.
Okay, let's park there for a minute. Just based on the feedback that you're giving right now, how have the changes that you've implemented, in addition to what you've said, the changes you've implemented within your team, how have they impacted the perception of security and the overall culture?
It's made an incredible impact, not only on our patients and our staff, but it's made an incredible impact on our officers. They understand so much about the importance of what we call wraparound follow-ups, where if you have a specific issue on the floor, not only do we go up and we actually deal with whatever that particular issue is, we will go up and follow up an hour, 2 hours, 6 hours later the next day, face to face, to make sure that you received the service that you needed. It's kind of like when you buy a car. What happens? What does the salesperson say to you? He says, "Hey, look, in 5 days, you're going to get a survey from Ford, and they're going to ask you if I did everything right, and I need to get 5 stars or I'm going to be in trouble." Well, that never happens when you have a security or a law enforcement interaction, does it? Well, if we can go, and if Brian has an issue and we follow up the next day and we said, "Brian, did you get everything you needed? Are you happy with what you need? Is there anything else we can do for you?" If we can do what we call a wraparound follow-up. Now, what's your impression of security? What is your impression of the professionalism of that organization? And all this simple human interaction, it's just a follow-up. And it's a great way to build trust and show that we provide customer service and compassion.
Excellent. Now, I'm curious now about training. So how does your approach impact training in terms of the Department of Public Safety and Security, as well as hospital-wide?
Training is probably one of my biggest passions, and I say that to people because I always mention that the only reason that I'm still alive today is because somebody at Kalamazoo Public Safety gave me really good training. because obviously being in law enforcement and firefighting, you were consistently involved in situations that were life-threatening, and I was able to get really good training. So we use a 3-tiered approach at Michigan Medicine, and it's called trust, training, and technology. And that's how we approach all of our security: trust, training, and technology. Well, the training piece, we focus on scenario-based training. And what we do is we've created a hybrid model where we take nurse educators, law enforcement, security, and then we get staff with some military experience, and we combine them and we co-present and co-create training for our staff. Some of the training, for example, that we've developed is a training called REACT. It's called Rapid Environmental Assessment Control Training. And that training is specifically designed for home healthcare workers to be able to safely go into your home and deliver that type of care. Excellent training. We've developed one called SAVE, which is Situational Awareness for Violent Events. And that's basically an active shooter type training where our staff are not only taught how to react in a run, hide, fight type mode, but we talk about pre-incident indicators. We talk about the nexus to domestic violence. We talk about how the most important piece of any type of situation like this is that human resources component, so we can hopefully get the person help before they ever have an incident. So training is such an important piece, and you've probably heard it before, but you remember, you don't rise the occasion, you sink to the level of your training. So at Michigan Medicine, we really focus on developing scenario-based training that meets the needs, whether it's in our adult emergency services, whether it's in our main hospitals, our children's hospitals, our home health care, and developing those trainings to keep our staff safe.
Yeah, and no, that's a really good point as well. I've been able to benefit from some very, very realistic scenario-based training. I'm just actually curious, how in depth will you go with the scenario? I know some of the training I've done, we've used like low light scenarios. We've had to do work on the stairs and stairways just to really get the feel for some of the things that you might deal with. What are some of the kind of unique things that you'll tie into your scenario-based training?
So we've actually done training where, obviously, low light training, we've used role players inside of actual houses where so the first step we did with our home healthcare training is step one, all of us went and did ride-alongs with home healthcare workers. That was step one. And we only had one rule. We said, take us to what you feel is your most dangerous urban environment house and your most dangerous rural environment house. From there, we worked with our home healthcare workers and we created scenarios that they felt were the most important. We used domestic violence scenarios. We actually had fake meth labs inside of homes. We actually had fake gunshots go off where the victim would scream that they were shot. And all of that training is based on real life events that occurred to home healthcare workers. So it's been phenomenal, and it's all open source, all free. All it takes is someone who cares and someone who's creative. And if you've got a bunch of nurses and a bunch of law enforcement, they all care and they're all creative.
Awesome. Now you've touched on trust. You've touched on training. I'm curious now, to complete the pyramid. How are you implementing technology into everything that you're doing?
Technology is such an important piece. And again, I'll drive this back to that every healthcare system is a community and every floor is a neighborhood. And in community policing, we use what's called CPTED, or Crime Prevention Through Environmental Design. And that's where we make sure that we design our buildings, we design our emergencies, we design our rooms so that we can use physical ways to help change the environment, whether that's access control, cameras, whether that's angling our desks in the right way so that it can help prevent a person from jumping over, raising those desks in a certain manner. Things like, the best way to explain CPTED is, imagine that you never want to have a tree with a branch below 6 feet, And you never want to have a bush outside that's above 2 feet. That way nobody can hide behind him. So nothing below 6, nothing above 2. And those types of physical changes to the environment not only keep people safe, but they make them feel safe. And then one other item that we are just now exploring in the health system are cameras that actually have technology embedded in them that learn the behavior, so that, for instance, if this camera is used to seeing people walk through a particular entryway and all of a sudden people start to run, it will alert the person in the dispatch center that there could be a problem. So it's those types of advanced technologies that help keep people safe. And then one that people don't often actually think of as a technology, but that's our security canines. So at Michigan Medicine, we now have our first ever security canine. His name is Leo, and he's a German Shepherd. And he is trained in both pet therapy and explosive detection. And he's probably had the biggest positive impact on our organization in terms of helping people feel safe. The first day we took him through the ED, we actually had nurses jumping in the air. They were so excited to see him. And we had patients, this is crazy, patients running out of their rooms to show us pictures of their own animals at home. It's just an absolute wonderful way to reduce both risk and anxiety of your patients, staff, and visitors.
Yeah, it's always interesting when it comes to the canines, and I was actually really hoping that you were going to bring that up. Now, I'm curious, when you're implementing some of these big changes, for example, bringing in Leo, and just the other changes that you've talked about, what are some of the steps you take in the back end? Like, is there a communication that will go hospital wide? Is there a campaign? Do you go out and kind of let people know what's going to be happening?
Oh, they're absolutely. The goal is to be completely transparent and completely inclusive. And so when we went through the selection process for the canine, we actually had healthcare leadership as part of the selection team, because they needed to have a say in who is actually going to be that officer. It's such an important position. And then in terms of communication, we had to meet with so many different groups to explain the why behind the dog, because not everyone likes dogs. And we have to be very respectful of that. And we have to make sure that we don't turn your visit to a hospital into a negative experience. And that was very, very important. So we were very methodical, very slow, and very inclusive to make sure we had input from nurses and doctors and everyone with how this program would be developed long before Leo was ever out on the floor. And then as we brought him into the health system, it was very important. We brought him in at night when it was quiet to let him get used to the noises, the sounds, the floors, the elevators, and to slowly get people used to seeing him. So he started maybe one day a week coming into the health system and then slowly moving forward. But it's a very successful program.
Excellent. Now I want to transition to leadership, because throughout this conversation, it's obvious that you've established yourself as a respected public safety leader. How would you describe your approach to leadership?
Well, thank you for that. Actually, I always say I've learned more about leadership through my failures than I have my successes. So the best way to explain my leadership philosophy or what leadership means to me is to tell you a quick story, because it really drives home what we're talking about. So I'm a brand new sergeant in Kalamazoo. That's a first line supervisor. And I've gone through a few days with another sergeant, and it's my first night by myself. It's my first 15 minutes of the shift. And it's my first time I'm ever going to supervise another person. And the first call that I get is a garage that is fully involved in fire that's connected to a house, if you could imagine. So I get there, and I'm the first one there. And sure enough, there is a garage attached to a house, and it's completely on fire. And I am scared. My voice is shaking, and I'm nervous. And I'm talking on the radio and explaining to the responding units what I have. Well, the first officer gets there, and he's driving the fire truck. No, he's been there longer at the department, and he knows more about fighting fire than I do. And I give my first order I've ever given in my life. And I said, okay, And his name was Dave. I said, Dave, I want you to connect to the fire hydrant to make sure we have water. And Dave looked at me and said, Brian, that's the wrong decision. And I said, what? He said, no, we should pull a hose line off the fire truck and go into the living room and try to stop the fire from advancing into the house. And I looked at him, I said, that's a lot better decision. And we went in and sure enough, saved the house. But we saved the house because of a frontline officer who wasn't afraid to disagree. And at the conclusion of that fire for the next several days, I was mortified because I'm like, oh, my first day on the job, my first day as a supervisor. And the first decision, the first command I ever gave, and it was wrong, completely wrong. But I learned some valuable things about leadership from that incident. Is number one is trust your staff, because they will do it right 99% of the time. Trust your staff. Number two is don't be afraid to admit you're wrong and that you don't know everything, because that night Dave knew a lot more than I did, and he saved the house. And then the next thing I learned was, remember, the next person involved in that scene or your project, I don't care if you're building a hospital or if it's a house fire, the next person on scene always has a better idea, regardless of rank, because they don't have tunnel vision. So from that, I kind of created two golden rules. So every time I have a meeting, I started by saying, remember this. Number one, everyone in this meeting has an equal say. And number two, I expect you to disagree. But you can't get people to disagree unless they trust you, which goes back to what we talked about before. Relationships and building trust and creating that teamwork culture. So that's kind of my garage fire story of leadership and a failure where I learned a lot.
Now, and I think a good segue is to talk about, I mentioned this earlier, some of the people who have worked for you that have went on to be industry leaders themselves. How do you approach leadership development and succession planning?
So much of that is we don't, what I found in organizations is that we don't do a good job with succession planning. And it's so important. And that has to come from both formal and informal leadership programs where you determine, okay, we have this number of this many leaders. We've identified who we think has potential or who wants to possibly move forward. And then you have to create those opportunities, and creating those opportunities both formally and informally are so important. When you see someone, there are so many leaders without rank, especially now that COVID has come up, and we'll talk about that more later, I'm sure. But I've seen so many leaders come forward who they're not supervisors, but they were under pressure. They rose to the top, and they were fantastic in the moment leaders. And by forgetting, it doesn't matter that they're not supervisors, that they're not managers, that they're not directors. Let's give them their opportunity to expand their horizons, to learn, to lead something. It has probably been one of the most successful informal ways I have found to develop leaders and then create succession planning. Because remember, trust your staff, because 99% of the time they'll do it right. Create an opportunity for them to expand their horizons, and they will rise to the occasion. And then hopefully develop mentor programs and create formal training programs that will also provide them that foundation. And that's really how we do it.
That's awesome. And you alluded to this a little bit, but 2020 obviously has been an interesting year, especially in light of this pandemic. What has the year of 2020 taught you so far?
Wow. It's been an incredible year. And I talked about it in the last question, but really, we have so many incredible employees, especially coming from the healthcare side, and we are faced with incredible challenges. And think about it this way. How often have you ever had to be involved in managing a critical incident, house fire, whatever that is, pandemic, where it not only impacts you professionally, but it impacts you personally, where your family members, your friends are losing jobs, or they may have gotten COVID, or they may have passed away. There is so much stress that I see on our employees, on our nurses, on our security staff. We've had multiple staff members throughout, several healthcare systems that have become ill. And what I've seen is incredible leaders, incredible what I call in the moment leaders, who just absolutely have risen to the top, who have stepped up to the challenge, who have found new ways to do things, who go above and beyond to make sure that we create that exceptional experience for our patients and for our visitors. And through so many things like our visit, every hospital has visitor restrictions, and trying to make sure that we somehow maintain that balance between that level of safety and making sure that we can ensure the health of our patients by allowing their visitors to some extent. It's been just a very challenging year, but in the moment leaders that have risen to the top is probably the biggest thing that I've seen.
Okay, one thing that's been kind of a really fascinating topic of interest for me lately has been just unintended consequences of the things that we're experiencing or the decisions that we make, either positive or negative. What are some of the unintended consequences that you expect to come out of everything that we've been dealing with this year?
Unintended consequences, great question. I think so much of what I see is there has been incredible staff burn. A negative would be incredible staff burnout. And this has been going on for 8, maybe 9 months. And I'm seeing, regardless of what your position is within the healthcare institution, I'm seeing people do incredible work, and that they're burned out, that they're putting in long hours, that things are stressed. So that's definitely been a negative outcome. But one of the positives is that we've been able to use technology to make us so much more effective. For instance, you and I are on a Zoom meeting right now, and we're having a great communication. We're seeing each other face to face, and that has made us so much more efficient. Now, conversely, we've all heard of Zoom fatigue, because when you could only put 8 meetings or 5 meetings in a day or 4 meetings in a day because you had travel, now you can put 8 or 10, and there's no time to decompress. So I think I will be interested to see what the mental health issues will be that come out of this, and people, like yourself, that are working from home, and how that impacts people both positively and negatively.
Absolutely. Now, one of the things I'm curious if this has changed for you, but I know generally you do a lot of speaking engagements. It seems like you're spearheading a lot of different projects. What can we expect to see from you or your team in the near future?
Well, that's been an incredible change. We have been doing our training now on Zoom. We do an incredible one called Situational Awareness and Violence Prevention. The training is designed to keep you safe before work, during work, and after work. And it's all designed using law enforcement and military tactics that help keep people safe. And that training now has had to been done on Zoom, and that is definitely challenging. One of the other things that we are coming out with is hopefully in the next week, we will be submitting an article to a large nursing journal, and it's on community policing-based security in healthcare. And that article will be submitted, and hopefully after it goes through peer review and they accept it, that you'll see that in the near future. And that the whole premise of that article will really be focused on what you and I have talked about here during our interview, which is trust, training, and technology, and focusing on reducing both risk and anxiety of our patients, staff, and visitors, but using those community policing principles that are used all over the world in neighborhoods and applying them to healthcare. And that's hopefully you'll get a chance to see that in the near future.
Excellent. Now, we covered a lot of different topics. Is there anything I haven't asked you yet that you'd like to discuss?
No, you've done a great job. You've definitely exhausted my topics. Very, very thorough. I appreciate it.
Oh, not a problem at all. And I guess as we're wrapping up, do you have a special message you'd like to share with the Healthcare Security Cast community?
Just that I'm proud to be part of the response. I'm so proud the individuals in the healthcare community throughout the country that I've had the opportunity to meet. They are so incredible, professional, compassionate group, and they have been faced with an insurmountable pandemic. but we will get through this. Feel burnout. We need to make sure we take care of our families. We need to make sure that we take care of our staff. And just as importantly, we need to make sure that we take time to take care of ourselves, because we're at halftime right now and we've got a little bit more to go before we're out of this, but we will get there. And it's just an honor to be here today and an honor to be part of the healthcare community.
And for anybody who wants to connect with you, what's the best way to do that?
Two best ways would either probably LinkedIn would be, which like how you and I connected, or you can always email me. And that is just buriridge@med.umich.edu. I'll say that one more time. And that's buriridge@med.umich. That's umich.edu.
Awesome. Thank you so much for joining us today, Brian. I'm sure everybody got a lot out of this conversation. I certainly did. So I do appreciate you taking the time.
Great. Thank you. I was honored to be here.
And this concludes another episode of the Healthcare Security Cast. Thank you for tuning in. Join the Healthcare Security Cast community. To join, text START to 647-372-2042. Again, that's text START to 647-372-2042. Follow the Healthcare Security Cast on LinkedIn and Facebook, and join the Healthcare Security Cast community groups on both platforms as well. Follow us on Twitter, Instagram, and TikTok. And of course, you can always connect with me on social media. I'm the only Brian, B-R-I-N-E, Hamilton, on any of these platforms. For any of these links, visit my website, Brian, B-R-I-N-E, Hamilton.com. That's BrianHamilton.com. Thanks again for joining us. Tune in again next week when we have a new guest and a new topic. Until then, take care and stay safe. Thank you.